Hello, my lovely friends. I am Dr. Arun Swami, your physiology faculty. Today, we are going to learn in this session the JVP, jugular venous pressure. Whenever we talk about the jugular venous pressure, this is not only important for your exam point of view, even this is also important for your clinical practice. So, let's learn the JVP. Whenever we are talking about the JVP, the first thing you should know that in JVP, we are actually checking the pressure of right atria, atrial pressure. So in cardiac cycle, whenever the right atrial pressure increase, the waves is going to the upside, and whenever the right atrial pressure will be decreased, there will be a descent into this graph. If we talk about the JVP graph, the JVP graph is having some waves and some descents are there. So three waves are there, that is ACV, which is showing that upper side, and upper side means that pressure is increasing into the right atria. Whenever the descent is coming, means downside wave is coming, this is showing the right atrial pressure is decreasing. So guys, please pay attention. What it stands for A, what it stands for X, C, X prima, V or Y. So guys, please pay attention. If we talk about the heart, we know that in the heart there are the four chambers, that is your right atria, right ventricle, left atria and left ventricle. So four chambers are there. We are checking in JVP the right atrial pressure changes. We know whenever the blood will come into this right atria, the pressure of this atria will be increased, and if the blood will exit from this right atria, the pressure will be decreased. Another thing, we know there is a wall between this right atrial and right ventricle, and the wall which is present over here, this wall we called as tricuspid wall. Guys, whenever the tricuspid wall closes, sometimes due to the downside pressure, this right ventricle um, this right ventricle pressure, the tricuspid wall is going to be bulge like this. Whenever this wall bulge like this, guys, the pressure of right atria will further increase. So any condition which increase right atrial pressure will take the waves to the upside. Any condition will decrease the right atrial pressure will take the JVP wave towards the downside or the descent side. So let's talk about the different waves condition in normal JVP graph. Guys, please pay attention. The A wave. A wave comes due to atrial contraction. So when the right atria is contracting, this right atrial contraction leading to increase the pressure of right atria will showing the A wave. After that, the right atria is going to be relaxed because एक बार अगर वो contract हो गया तो then the next part is going to be relaxation. So the next part it is going to be relaxed. When the right atria is going to be relaxed, the wave will come towards the downside. It's showing the pressure is decreasing, which we'll define with the X. Now the tricuspid wall. This tricuspid wall which is present over here, this tricuspid wall will be closed, and over here isovolumetric contraction will be start of the right ventricle, which will increase the pressure in right ventricle. So this tricuspid wall will be bulge like this and leading to further increased pressure into the right atria, which will signify the C wave. So that is will correspond to the C wave. Now after that, the blood will eject out. After that, the blood will eject out from the right ventricle. This bulging, this tricuspid bulging will come down. The pressure will also be come down, and it will showing this X prima wave. And now after that, this right atria, it start filling from the veins, from the central vein. So volume is increasing, pressure will be increased, and guys, this is we called as venous filling, which will define by the V wave. After that, there is a passive emptying or the passive ventricular filling will be occur, and in this part, when the blood will eject out from the right atria, the pressure will be decreased, which is corresponding to the Y wave. So now guys, you can easily understand. If I'll make this picture over here once again, you will have the better understanding from this part. So we are checking the pressure of this right atria. So one more time, please pay attention. When this right atria will be contract, we call it as a atrial systole or atrial contraction. This will show you the A wave, pressure is increasing. After that, this chamber is going to be relaxed, means atrial relaxation. It will show you the X wave. Then the tricuspid valve will be closed, and due to the isovolumetric contraction of right ventricle, the pressure is putting on the tricuspid valve, which will lead to the bulging of this tricuspid valve towards the right atria. This will show you the C wave, and then your blood is getting eject out from this right ventricle. So this bulging will be come down, which is leading to X prima. Then the central vein will send the blood into the right atria, which will increase the further pressure of right atria, which is defined by the V wave, and then the right atria is going to be empty. Right atria is going to be empty passively, which is we call as atrial emptying, which will define by the Y wave. So these are the normal waves of the JVP. Now let's talk about the abnormal waves. In abnormal waves, please pay attention. In abnormal waves, please pay attention. That's absent A wave is seen in atrial fibrillation and sinus tachycardia. Flutter for flutter, that is atrial flutter will show you the flutter waves. Prominent A wave will be seen in first degree heart block, which is also called as first degree atrioventricular block. Then large A wave, this is due to the tricuspid stenosis, right atrial myxoma, pulmonary hypertension, pulmonic stenosis. And Canon A wave is seen in atrioventricular dissociation, which is third degree heart block, and which is also seen in ventricular tachycardia. Then absent X descent, this could be seen in tricuspid regurgitation. Prominent X descent will seen in that condition causing which is enlarged A wave, and large CV waves in tricuspid regurgitation, constrictive pericarditis, slow Y descent in tricuspid stenosis, right atrial myxoma. Similarly, the rapid Y descent can also be seen in both conditions, and rapid Y descent in constrictive pericarditis, severe right heart failure, tricuspid regurgitation, and atrial septal defect ASD, and absent Y descent, that is in the cardiac tamponade. Guys, you must also be remember, whenever the JVP falls during the inspiration, that is the normal condition. It means whenever we are doing the inspiration, our thoracic chamber is coming out, all the thoracic organs are expanding in size, and so that the JVP will be false. So during normal inspiration, the JVP ideally should be false, that is normal condition. But during the inspiration, if JVP increased, guys, this condition we call as Kussmaul sign. Guys, don't be confused with the Kussmaul breathing. Kussmaul breathing is hyperpnea and tachypnea, which is seen in diabetic ketoacidosis. But the Kussmaul sign, this is when the JVP is increased during the inspiration, we call it as a Kussmaul sign, which is seen in constrictive pericarditis, restrictive cardiomyopathy, right ventricular failure, and this is not significant in cardiac tamponade. In cardiac tamponade, the significant part is Bake's triad. What is this? Bake's triad. Bake's triad, and Bake's triad having the three component. The number one is muffled heart sound. Number two is hypotension, and number three is large dilated neck veins. So these are the three things which is significant for the cardiac tamponade: muffled heart sound, hypotension, and large dilated neck veins. Thank you for watching this session. Thank you.